public sector strike has been marred by violence and intimidation. It's now impacting various hospitals, including the Charlotte Maxeke Hospital. We would have told you a bit earlier that the minister was on a walkabout at the hospital. He's now briefing the media. Let's listen in.
Its members and any other associate from engaging in any activity of obstructing entrance into any health facility here in Gauteng province, but also going beyond that, not only physically but even intimidation is very clearly expressed in the court order that is prohibited, and also ordering the South African Police Service to act if anybody is going against that court order in any way, preventing workers, preventing also members of the community from accessing the health facilities. So that is from where we were last night. This is a major step forward in the sense that this court order now, it's effective. So the situation has improved quite a lot. If we start with just here at Charlotte Maxeke, yesterday the hospital was quite besieged. From in the morning, we received accounts from the hospital management, various divisions, casualty, theatre, various ICU wards, adult and children's ICU wards, who were really, giving us very horrendous stories of how they struggled to get in to come and save lives. But we can say that overnight, during the course of the night, from the reports we've received, those who were on night duty were able to come and render the services. From this morning, we're here with the Premier earlier on, and we also did walk about in the hospital, in the accident and emergency, into the maternity areas and into other areas in the front line. The staff was there, and many of them were indeed very relieved that this morning they were able to come to work without any obstruction. So thanks to the cooperation also from the members of the South African Police Services. So as we can see, even though and how members are still outside the gates, but they are today behaving in the manner which is expected of all law-abiding South Africans, in the sense that those who want to demonstrate, they are there gathering, demonstrating, singing, but not obstructing those who want to come in. I'm sure even members of the media would have seen that both staff and also members of the community who are coming to seek assistance in the hospital are coming in freely, and those who are leaving are also leaving, free of any obstruction. So that is exactly what we expected. Maybe just to on that, we just came back from the Helen Joseph Hospital, where the operations are running, but we were unhappy with the fact that the main gate was still having obstruction. The strikers and demonstrators were still obstructing smooth entrance into the main entrance. We spoke to the leadership of the police services. We met the brigadier who's responsible there with also the local station commissioner, and we explained to them the terms of the court order. Unfortunately, they were not familiar, but we familiarized them, and also made sure that the CEO leaves them also with a copy. And by the time we left, they promised that they were going to make sure that the court order is implemented, in the sense that making sure that the main entrance is free of any obstruction. We still getting reports here in Gauteng that some of the hospitals are still experiencing some challenges. We will be following up with that, because our responsibility is to make sure that with all the efforts which have been taken, that the court order is fully implemented. We are informed that there's still some challenges in the Val at Kopanong and Sebokeng, and then in Ekurhuleni at Telemugerane Hospital, there's still some challenges there, and I'm sure the MEC can add a bit more in terms of some of those. And in Soweto, at the Bheki Mlangeni Hospital, that there's still some challenges, and also at the medicines depot, medicine supply depot, that it's also still experiencing some obstruction. I've already spoken about Charlotte. Chris Hani, there has been consistent demonstrations, but outside. So it has not been inhibiting clinical activity inside the hospital. But we just learned earlier on that people were refusing to be dispersed by police at the entrance. It looks like, even though we don't have the full details, police had to use rubber bullets to disperse the crowd. But it's not inside the premises of the hospital, but it was outside. I think it came to the stage where police believed that they were becoming an obstruction to staff and members of the community to enter the hospital. So I've already spoken about Charlotte and then the Baragwanath. So we have assigned both from the province and from the national department, the DG here and the head of department of Gauteng. We have agreed with the MEC to task them to make sure that senior managers, both from the province and also from our national department, because as a national department, we are also, accommodated by Gauteng. So Gauteng must benefit from our presence here. So we have also deployed our own senior managers to support Gauteng, also seeing that it is a major target of the disruptions. So at this stage, we have a sense that the level of violence and intimidation has scaled down. Many of the hospitals, there's a lot more activity, more staff are coming in. So we will be following up on the ones which I've mentioned where there seem to be still some obstruction. But remembering also that this labor action is not only in Gauteng. I did mention yesterday that the highly affected provinces is Gauteng, then the Eastern Cape, those have been quite highly affected, and then KwaZulu-Natal and the Free State, and a bit of Northwest, especially in the Klerksdorp area. So we're working with all the provinces to ensure that the services can, be adequate and as soon as possible returned to normal. But we are aware that because of it in the affected provinces, some of the services have to be rescheduled. Non-emergency services have to be rescheduled, but nobody who needs emergency attention should be turned back. Those who have been rescheduled must be given appointments so that they can be attended to speedily. And those who are on chronic medication, they must be assisted to make sure that they don't run out of their chronic medications. And as I said, non-emergency services like non-emergency surgeries can be rescheduled. So besides Gauteng, the Free State also has obtained a court order, KwaZulu-Natal also, Northern Cape, and also the Eastern Cape. In the Eastern Cape, the reports which we have received is that things are much better today. The province also engaged with the union and tried to find some amicable agreements, and the report we're getting today is that the situation is much better. A lot more services are happening. KwaZulu-Natal, in KwaZulu-Natal also they have increased their security, including procuring more private security over and above the South African Police Service, and this has improved the safety of the staff. In the Free State, also the situation is much calmer today since this morning. There are still some reports of striking staff members trying to disrupt, including quite disturbingly that some of these strikers were even trying to destabilize in one of the ICUs. So we will be following up on this to make sure that this doesn't happen any further. In the Northern Cape, the report indicates that there was more disruption in the outskirts of Kimberley, in the area called Buckley West, moving from the center of Kimberley, from the main hospital in Kimberley, the Robert Sobukwe Hospital, going into the targeting now the clinics. So as I conclude, and as from the questions, I'm sure maybe as I conclude, I would ask the MEC maybe just to add a few details, especially with regard to Gauteng. We are coordinating nationwide, working with the heads of departments, with the MECs, to make sure that the situation can be returned to normal as speedily as possible. From our side, we're giving them all the support. We also will be sharing information later today, just to make sure that we have a very coordinated response to this. We again want to appeal to the leadership of NEHAWU that while we don't want to interfere with their rights as enshrined in the Constitution, the right to withdraw their services, but this must be done firstly in a manner which respects the fact that health services are essential services. That's one, but also desist from any violence, intimidation, and physical, disruption of activities, and anything which borders on violent activity. And on our part, we will do everything with the support of our security services, and also everything which is within the law in terms of making sure that those who engage in such activities must also face the consequences of such. So we're not going to shy away from our responsibilities in that regard. Thank you very much. Maybe MEC, if you want to add a few things on the Gauteng.
Thanks, Minister, and good morning, colleagues. Minister, I think the issue that maybe it will be of interest to them, which you have touched on, is the issue of contingency measures that we have done, especially in areas where we've been affected as a province. We will definitely make sure that all the appointments that have not been attended to will be rescheduled, especially in areas of operations. So a team is working very closely with the national to ensure that that is done, and we will have a catch-up program in some of the programs that we were supposed to do, because we have been busy with the surgical backlogs in the province, as you have been aware, that we have started. But now even in that area, we'll definitely make sure that we go back to that program and start to look now into the dates and the arrangements that we've made with some of the hospitals, where we've even, because we've been sharing even some theaters in other hospitals. So we'll make those rearrangements. And some of the patients who were discharged that need to be given enough medication, we will definitely alleviate that pressure through the health system, because we have a process that we do of localizing health. We will go to specific areas where they are and ensure that we distribute the medication so that they don't suffer, especially the chronic patients that we have. And I think on the elective operations, those that have been postponed, they are going to be replaced. I know even here at Charlotte Maxeke, they had to be rescheduled, some of the major operations that were going to be done. So, but now we're going to go back, and then CEOs are working on those plans of making sure that those are being done, Minister. I think other things we have done, but we're working very closely with a team of all the CEOs. We have meetings. We have a command center that we have established immediately. DG's team is part of that command center in terms of advising us of what needs to be done, CEOs reports on hourly basis on what's happening in every hospital, and now we're bringing in the team, as Minister was saying, from the community safety side, so that they become part of the command council, so that they are able to report directly to us, and then we spread the message. And we're hopeful, Minister, with the support that you have given us, as a province in particular, because we're the one that have been hit hard by the strike. Your assistance is helping us. People have positive response. Even the CEOs feel that you are part of us. Through your support, we will definitely achieve this. Even the issue of the medical support, the MSD, which is the medical depot that has been closed, we have measures in place. There is no hospital at the moment that doesn't have medication, because CEOs are working in a clustering manner. Where we have a shortage of linen or medication, they are able to reroute and send the medication where it's needed most. So, Minister, I think those are the things that I wanted to add to the team.
Well, maybe just to also take the opportunity to, appreciate and thank our healthcare workforce all over the country. It was really quite heartening meeting some of them this morning. They were also appreciating the support and the fact that with the improved security, they are able to come to work. So on behalf of all South Africans, I think we should thank our healthcare workforce all over the country for their diligence and their care. Some of them, when they explained, for instance, here, how they had to, take all sorts of risks to make sure that they can come and save lives in the hospital. And we know all over the country there are many other heroes and heroines.
All right, those are live visuals at the Charlotte Maxeke Hospital, where Minister Phaahla has been briefing the media. He's painting a picture of a somewhat more stabilized situation. He says the violence as well as intimidation has scaled down. Hospital staff were finally able to come into hospitals overnight, and then this morning again they were able to come to work without any obstructions. Now, members are those still at the gates but are protesting away from the gates. He has also stated that those on chronic medication must be assisted with their medication as soon as possible.